host, Dr. Tahani Zaidi, a public health resident. Welcome back. Today, we'll be talking about a very important public health concern, maternal sepsis. And for this, we have an amazing guest with us, Dr. Sheikh Irfan. Dr. Irfan holds a PhD in Maternal and Reproductive Health from University of Birmingham, and his research spans across maternal infections, especially maternal sepsis. I'm excited to welcome him on the show. Let's get to know better. Welcome, Dr. Sheikh Irfan, to our podcast. It's really exciting to have you on here.
Thank you for having me, and I appreciate the opportunity of discussing this important health issue in this podcast.
So you, as a researcher and as a practitioner, have done a lot of work on maternal sepsis, and your work is commendable. But I would like you to bring back down to the basics of maternal sepsis. So let's start with what is maternal sepsis and why is it a public health concern?
So maternal sepsis is considered as a severe infection leading to systemic inflammatory response during pregnancy, childbirth and postpartum period. So the condition can rapidly progress to shock and organ failure. It's a significant public health concern due to its high morbidity and mortality. It is essential to address maternal sepsis to improve maternal health outcomes and reduce preventable maternal deaths.
So what I understand is that it's preventable. Can you share what are the risk factors that leads to development of maternal sepsis?
So the main causes of maternal sepsis are bacterial infections, mainly originating from genital tract, urinary tract or surgical sites such as cesarean sections. The common risk factors include prolonged labor or premature rupture of membranes, retained products of conception, poor hygiene, inadequate infection control, delayed or inadequate access to health facilities, and then pre-existing medical conditions like diabetes, immunosuppression.
Okay, so you mentioned that unhygienic conditions and someone from lower middle income countries, that is very prevalent in our region. So then coming to the question that what is the actual prevalence and incidence of maternal sepsis in lower middle income countries?
So maternal sepsis accounts for 11% of maternal deaths worldwide, with an estimated 5.7 million cases as reported in Global Burden of Disease data. It's particularly prevalent in low middle income countries. Sub-Saharan Africa and Asia face the highest burden of maternal sepsis due to inadequate healthcare infrastructure and healthcare services. In Eastern Mediterranean region also, a 2019 Global Maternal Sepsis or GLOS study reported that around 51% of women are affected by maternal sepsis, and it remains a critical concern in countries like Afghanistan, Pakistan, Somalia, Yemen, Djibouti.
That's a really high number, and that's a lot of prevalence and incidence, a lot of number and a lot of cases. So, but then again, coming to the point that if it's that prevalent, is it manageable? And a woman who has been affected by maternal sepsis, is suffering from it, is she, can she survive, or is it just hopelessness?
So the aim for the management of maternal sepsis is to stop its progression to shock. WHO recommends using sepsis surviving criteria adjusted for obstetric population, and the key components include early hemodynamic and respiratory stabilization, administration of empiric broad spectrum antibiotics, ideally within 1 hour of diagnosis, and then controlling the source of infection within 12 hours of diagnosis, and further then preventing and managing its complications. However, the standardized diagnostic criteria is still required to identify severe maternal infections in order to improve perinatal health outcomes and reduce maternal deaths.
Okay, so the reasons or the factor or the steps of management you told are usually health system centered when a patient comes into the hospital, and then what can be done because of the administering the empirical antibiotics and taking care of the complications so that they cannot develop. If I were to ask you, how can it be prevented on a large scale in the community? So what are those steps that can be taken for the prevention in the community?
So the prevention of maternal sepsis needs a robust infection control and prevention processes, especially in low middle income countries and low resource settings. So the key measures include hand hygiene, which is essential for the prevention of transmission of infections and emphasized in WHO guidelines. Then incorporating water, sanitation and hygiene services in health facilities for the prevention of maternal infections, for patient safety and to achieve sustainable development goals. And then proper use of topical antiseptics, safe and sterile operational techniques, and then administration of prophylactic antibiotics can reduce the risk of infections. However, administration of antibiotics needs to be carefully balanced against the increased risk of antimicrobial resistance. So poor infection control and prevention practices are common in developing world and leading to significantly high rates of hospital-acquired infections as compared to high-income countries. So incorporating WASH and other measures that I just mentioned can reduce the risk of infection and improve maternal health outcomes.
Thank you for that answer. And the steps that you told us, very simple steps: hand hygiene, wash, and all of that. And the numbers that you told us, very prevalent in lower middle income countries, high incidence, high prevalence. The steps to prevent are very easy, but the outcome and in the sense of numbers, we don't see it that much. So brings me to our next question, that is, what are the challenges? What are the challenges that these lower middle income countries and countries of EMRO are facing for dealing with maternal sepsis?
So the main challenge in the management of maternal sepsis is the need for a robust or a rapid health response system for the early recognition and management of maternal sepsis, especially in low resource settings. And the other challenges includes resource allocation, that is lack of laboratories, lack of blood culture sets or trained healthcare attendants, and then differences in the common causative pathogens in the low resource settings as compared to high resource settings, and the unique risk factors and health conditions of populations in low resource settings, and obviously the inadequate health infrastructure and inadequate access to health facilities. So these all gaps hinders the effective management and prevention of maternal infection and sepsis and needs to be addressed on priority basis.
Okay, so all of the management factors that you told us, they're mostly related to healthcare system, centered around the healthcare system, like limited resources, limited healthcare workers, not enough capacity for the healthcare workers. I want to ask, how can this be managed? Like if a researcher wants to manage it on a community level, so how can that be managed?
On a community level, so the first step is to, and that's the basic step for any other health intervention, to raise awareness, because still this is the area which is least researched, least addressed till date. So the first thing that what I believe is the basic step is to raise community awareness and to educate people on the early signs and symptoms of infections, so they could reach out to health facilities rather than delaying it till the time when it deteriorates. And because in our countries, when there are issues with the availability of health resources, and most of the time patients are ending up at very late stages at the hospital facilities, and by that time they have a full-blown sepsis. And so that's the thing where the community and the population needs to be educated on the early signs. So as soon as they get early signs and symptoms of infections, they should be reporting to nearby health facilities and then referred to the facilities which are well resourced to treat such cases.
We have talked a lot about serious stuff, and thank you for sharing those insights for maternal sepsis. I think this is a very important public health topic that we often don't talk about, or we often don't research about. So that brings us to the very fun part of our podcast, and this is rapid fire questions. And we do this with every guest. So I want you to be quick, I want you to be rapid, and I want your answers to be full of fire. I hope so. So let's start.
Sure.
So prevention or treatment?
Prevention.
Lifelong experience or experience driven?
Experience driven.
Evidence or anecdotes?
Evidence.
Like always.
Yes.
Local wisdom or international knowledge?
International knowledge.
Numbers or narratives?
Numbers.
Knowing the why or knowing the how?
Knowing the why.
Okay. Knowledge based or hands on?
Knowledge based.
The science or the street smart?
Science, obviously.
Reading up or reading between the lines?
Reading up.
Job aids or memorized steps?
Memorize steps.
Okay. Knowing it all or knowing when to act?
Knowing it when to act.
Nice, smart. Armchair expertise or battlefield peptides?
Probably battlefield peptides.
Oh, thanks. So thank you, Dr. Sheikh. It was a very good conversation that we had and very insightful. I am grateful that I had to have this conversation with you. And we'll be hoping to see you again for the second part. Sure. Thank you for listening to us and tuning back. We hope that you're equipped with all the knowledge related to maternal sepsis. I had a good time in the conversation. Until next time, this is your host signing off. Take care.